So let's finish out the surgeon workflow. We ended with the patient getting a diagnosis, putting in your orders, the key plan orders for the patient to leave, which included any labs imaging, specific procedures to schedule, any follow-up if indicated, or a records request or a surgical clearance. Get those in, commit those, and move on to the next patient. Then when you have that chance, off of your daily schedule, you got that note that's unfinished. So we will take this departed patient and finish up the note. Single click into the note. Bottom left, quick view of the note to see what you have and what you still need. Chief complaint, some HPI got in there with help of nurse. Structured history items all in there, vital signs. No exam is in here. We already have our assessment and our plan here because we had put those items in before letting the patient go. So this patient has a breast lump, and it was decided to do a bilateral breast MRI and an ultrasound-guided breast biopsy. And we used a little potential risks, benefits of procedure order in there that shows up in the plan. So I close the note, and then I can go to the history free text form here, and I can add some more details. And I have my M modal over here on the right, currently in a sleep mode because of the way this video is, and I can wake up, new line. The patient has not had any symptoms of breast pain or discharge, period. She has not had any previous breast disorders, period. She says she is quite worried because her sister was diagnosed with breast cancer 3 years ago, period. Go to sleep. I can move to the breast image, figure out which tool I'm most comfortable with using. But I will review. So the ellipse tool is best used with a single click and then a click and drag at a 45-degree angle. That's how it's best used. After you do that 45-degree angle, make it the size you want. You can move it wherever you want. Resize, and then click the apply button. Under the exam, you can use your M modal again. This time I'm going to just click the button to wake it up. Pleasant female and no acute distress. New line. 1.2 centimeter firm, movable nodular mass in the upper outer quadrant of the left breast without associated adenopathy or skin inflammation or nipple discharge, period. The rest of the breast appears normal. Period, new line. Right breast exam is unremarkable, including no axillary adenopathy, period. So now you have a history and an exam in here. Other things you could do at this point would be to put a little bit more color into go to your assessment, and you could go to the pencil into the lump of breast left. And insert some information. 2 centimeters left upper outer quadrant, comma, 4 centimeters from the nipple. We've already done our orders, so unless you feel like you needed to add something else, or maybe you had forgotten to click the procedure risk benefits, that's where that will be. Then you have the plan details free text box. And what you might put in here would be as follows. Orders as noted above, including the imaging and planned procedure, period, new line. Follow-up and next steps will most certainly depend upon the above orders, and we will arrange appropriate follow-up at that time, period. Then we're continuing to work down my table of contents. I'd already committed the diagnosis previously. I have some text and stuff I haven't saved, but I've already committed the diagnosis, so I can add my code on, whether I use the regular visit codes or the consult codes. Depends on your practice. I might take one last view of my note to make sure I've got all my sections. I can go to my charge summary, confirm all as well with a smiley face, and then use the submit and sign button to both submit the encounter form to be reviewed and to sign my note at the same time. Confirm that you're about to sign a note under your login. It'll show you some carbon copy recipients, which will typically be the primary care physician and anyone else you may have added. If there was still some information to commit, such as the detail I added, then just save and continue. It'll take you to the billing area, but you skip that. You just go back to your daily, confirm that you have your signed off note, that's final, and you have your charge submitted. You can move on to the next. Hope this is helpful. Be seeing you soon.